Hello everyone, I am Swapnil Banerjee, and today in this video we are going to talk about a very important topic, that is carotid triangle. So carotid triangle is a triangle of our neck and one of the main important triangles of our body. This is the triangle where common carotid artery divides into the external carotid artery and internal carotid artery. We shall talk about this in details in this video. We shall talk about its floor, boundaries and contents. So now without wasting any time, let's jump into the main topic. So now coming to our topic, whenever we study about a triangle, we have to study about three things: boundary, floor and its content. So now coming to carotid triangle, here we have three boundaries: the anterior superior boundary, anterior inferior boundary and posterior boundary. Posterior boundary is formed by the sternocleidomastoid. The anterior superior is formed by posterior belly of digastric and another muscle, that is the stylohyoid muscle. Okay, and the anterior inferior boundary is formed by the superior belly of omohyoid. Okay, so now these are the boundaries of the triangle. Now we'll have to learn about the floor. Floor is formed by four muscles. There are two constrictor muscles, the middle constrictor and the inferior constrictor, and two another muscle are hyoglossus and thyrohyoid. So now talking about the contents, here we can see the common carotid artery is coming and it is dividing at the level of C3 and C4, and it is giving us two branches, the external carotid artery and internal carotid artery. Okay, so the external carotid artery gives us 8 branches, but you will have to remember that in the carotid triangle there's only 5 branches present, and these 5 branches are, okay, let me show you. These 5 branches are lingual artery, facial artery, occipital artery, superior thyroid artery and ascending pharyngeal artery. Okay, so I have a mnemonic for that. Let me write that. The mnemonic is L fossa. Okay, you will have to remember that this fossa contains only one S, not two S. Okay, 5 branches as I have said. So L for the lingual artery, F for the facial artery, O for the occipital artery, S for the superior thyroid artery and A for the ascending pharyngeal artery. Okay, so now coming to the internal carotid artery, there is no branches, so 5 branches of external carotid and no branch of internal carotid. And now coming to the vein, there's only one vein. Again, look at the diagram, there's only one vein, that is internal jugular vein. Okay, and now coming to the nerve, we'll have to remember about the name of 4 nerves. Here comes 3 nerves, 3 best friends. Okay, 10, 11 and 12 nerves. So tell me the names. 10 nerve is the vagus nerve, 11 nerve is the spinal part of accessory nerve, and 12 nerve is hypoglossal nerve. Okay, so I already said 4 nerves, so which is the 4th nerve? So our 4th nerve is superior laryngeal nerve, and that is a branch of our 10th nerve, the vagus nerve. So whenever we read about the contents, we can remember it easily with the trick of A, N, V. A for artery and for nerves, V for veins. We'll have to remember that which arteries are passing from that place, which veins are passing and which nerve. So in that way we can easily remember about. And here I have already said 6 contents. So 1 artery, common carotid artery, their branches, external carotid, internal carotid, external carotid giving 5 branches here, and 1 vein, internal jugular vein, and 4 nerves. Okay, so I hope that is very clear. Again, coming to the image, let me zoom it a bit. I think it will be clear. Okay, we'll study a bit about the image. So here again, let's summarize it with me. The boundaries: anterior superior, anterior inferior, posterior. There 2 muscles are forming this boundary: posterior belly of digastric and stylohyoid, and this one is by the superior belly of omohyoid, and this one is by the sternocleidomastoid muscle. And talking about the floor, how can we remember the floor easily? We have to remember that there's a bone hyoid. There will be 2 muscles that will contain the name hyoid in it. So one is thyrohyoid, one is hyoglossus. Okay, and behind that 2 constrictor muscles, one is middle constrictor and another one is inferior constrictor muscle. Contents: common carotid, C3, C4, breaking it in external carotid artery, internal carotid artery. Nerves: this is the vagus nerve, this is spinal part of accessory nerve. You can see that it is going towards the sternocleidomastoid, and from vagus a branch comes, that is the superior laryngeal nerve. In the comments, tell me that to which muscle is supplied by the superior laryngeal nerve. Okay, I'll wait for your answer. And now about the vein, here we can see the internal jugular vein. So we have completed the contents, boundary and the floor. So that is it for the video. I hope you all understood the topic properly. If you understood properly, you can subscribe our channel for some other videos, and you can also share this video with your friends. And now I will meet you in the next video with some other topic. and bye.